I've been fascinated about medicine since probably the 8th grade. Was always a science and biology buff. Went to medical school originally because I was very interested in the basis of disease and the causes of disease, and that ultimately led me into internal medicine, which was the specialty that I trained for in residency and ultimately board certified in. Because the difference with internal medicine is that you're much more interested in getting to the heart of a problem rather than simply treating symptoms on the surface. I think probably the biggest piece is the continuity of care, the actually being able to take a patient, in total instead of just treating, little individual problems of theirs. But more importantly, you've got the time to really get to know them, to get to the bottom of their case, to do the learning that you need to in between patients to make sure you can help each patient individually, to do the research that you need to in order to keep up with that. And here we really have our own medical world that we can give feedback to each other on a very regular basis. We pass each other in the hallways. All of the time we stop and ask questions. I have fortunately some very, very good experts in this building in hormonal issues and male and female hormonal issues. So I believe we're doing quality work. As with any medical enterprise, there are going to be misadventures. Our job is to make sure that those misadventures have as little negative effect on the patient as possible. Make sure that obviously safety is still the first consideration, but by the same token, we're dealing with probably a larger number of patients that have problems that they have sought solutions for lots of other places prior to this. And to be able to offer a potential solution that has not been successfully tried yet is frequently not only very gratifying, but the patients are very grateful for it too.